Hello, my name is Angela DeRolph, and I am your Perry County Health Commissioner working at the Perry County Health Department. Today, I am asking you to please help us help you. Throughout this COVID-19 response, there have been things that have occurred that were out of our control. We can't control the orders issued by the state, or who has been given permission to reopen, or who has had to remain closed. These are decisions that are made at a much higher level. What we can control and what we are doing is we are working with our businesses, our schools, and other events to make sure that they operate as safe as possible. If you have questions on how to make your business or activities safer, contact us and we can help you. We also can't control your personal decisions. The choices that you make are up to you. What we can do is provide you with information and share with you the evidence-based guidance and recommendations that can help you make the best choice for you. As you know, we are seeing more cases in our county. These cases can be attributed to people traveling out of county for work or for other reasons, or even traveling out of state for vacations. We're also seeing more cases due to family and friends getting together. We ask that you implement our recommendations as you live your life to help decrease your risk and the risk for others in our county. Remember that the choices you make today and your actions will directly impact us on our future. We know information changes rapidly and the guidance has changed over time, and we know people are frustrated with that. But what you have to remember is that we are still learning about COVID-19 every day. So what's appropriate now may not have been even realized a few months ago. And as we move forward, our guidance and recommendations may continue to change as we continue to learn more. We ask that during this time that you work with us and we get through this together. We have also heard you about wanting more data and even zip code data. And we have a team working to get you more information. Speaking of information, yesterday the updated Ohio Public Health Advisory System was released, and Perry County still remains at a COVID-19 risk level 2. As a reminder, risk level 2 means that there is an increased exposure and spread, and that you should exercise a high degree of caution. This happened because the data at the state's comprehensive monitoring team had been looking at and had been analyzing showed that Perry County triggered 3 data indicators. So the first data indicator was that Perry County saw an increase in the proportion of cases not in congregate settings. And as we mentioned last week, a congregate setting usually refers to long-term care facilities or prisons. So since this increase was not within a congregate setting, this is an indicator that there is a greater risk of community spread. We also saw a sustained increase in new cases. For this indicator, the state looks at a 7-day moving average of new cases to see if there was a 5-day period of sustained growth, which in our case, there was. Lastly, Perry County also saw a sustained increase in outpatient visits. So this indicator showed an increase in the number of people visiting outpatient settings with suspected and confirmed COVID-19. Therefore, it is so important that we continue to follow the evidence-based recommendations. So as I mentioned last week, it's important that we continue to take our temperature and monitor our symptoms. If you are sick, you need to stay home, and if you have health concerns, you need to contact your healthcare provider. We need to continue to maintain social distancing of 6 feet or more when we're around non-household members. When we're in the public, we need to continue to wear our face coverings, especially when social distancing is hard to maintain. We need to increase caution when interacting with others not practicing social distancing or wearing face coverings. And of course, if at all possible, avoid traveling to those high-risk areas. And we need to follow those good hygiene standards. We need to continue to wash our hands or use hand sanitizer. We need to continue to not touch our hands or our eyes, nose, and mouth. We need to cover our cough with a tissue, throw the tissue away, wash our hands again. We need to make sure we're cleaning those high-touch surfaces. We also need to make sure that we are avoiding contact with anybody that is considered high risk. As we get older, our risks for COVID-19 increases. We also know that pregnant ladies have an increased risk, as well as people with underlying health conditions. So if you fall into one of these categories, you really need to start implementing these safety precautions. You really need to decrease in-person interactions outside the household as well. And like I mentioned, if you are sick, you need to stay home. So please continue to practice the evidence-based guidance and recommendations that I just shared with you. Remember, the public health advisory system is like an early warning system or like the weather forecast. It shows us where we are now and also what may lie ahead. It's up to all of us to take actions now that will decrease our risk of exposure and potential spread of COVID-19. So join me. Wear your mask, social distance, wash your hands, avoid crowds, clean those high-touch surfaces, and if you are sick, stay home. Remember, we are in this together, and we are Perry County Strong.